I faced a little bit of challenges even within the family structure, because you find that some family members do not understand. Sometimes they feel like you are pretending you don't want to go to school when you've had quite a number of crises, painful crises, and you need to rest, or you are in pain and you can't have like a normal day in school, and you need that rest. So sometimes they will not understand. But I wouldn't blame them, because there was not much awareness then, and right now there's a lot of conversation going on about sickle cell, but still there's more work to be done in the world for even to create inclusive communities within the family structure and even in the community, to be able to accommodate persons living with sickle cell. I'd say sometimes also I'd face stigma in school, because most people thought that I remember there's this one incident when I was in primary school, when that a certain classmate said that I had HIV and AIDS. It was bad, because during that time there was a lot of stigma.
Today we are proud with Hellen Adhiambo, a sickle cell warrior and advocate, and a CEO of Lending Hands Initiative, a platform that empowers patients and caregivers through advocacy and compassion. Her story is one of the pain turned into purpose. Hello, Hellen.
Hello, Pius. Thank you so much for having me.
You're welcome. Have you been?
I'm fine, thank you. How are you?
I'm good, thanks to God. So would you kindly introduce yourself?
Yeah, my name is Hellen Adhiambo. I am the founder and director of a community-based organization called Lending Hands Initiative. I'm also a patient with lived experience for sickle cell. Yes, and I'm glad to be here today.
You're welcome. You being your own Shujaa through your initiative is changing, or even crafting a voice out here that will even change someone or even motivate someone in the future, or you being your own Shujaa. So when did you first know that you have sickle cell?
I'd say I found out that I had sickle cell from a very tender age. Since I started going to kindergarten, I find out that I had sickle cell, because most of the time, maybe at that time, I didn't really know that it was sickle cell, because I was still a kid. But the frequent clinics with my brothers to Kenyatta National Hospital, the monthly clinics, the painful crises, the hospital admissions. Then with time, I came to learn my condition and know how to maybe manage, because I saw from a tender age, my brothers will take me for monthly clinics. I'd be put on daily drugs like Paludrin and Pain V at that time, and folic acid. So I found out at a very tender age that I had sickle cell.
So you mentioned the hospital visits, your brothers, and how did you cope up with you knowing that you had sickle cell around your family, around your brothers? What do you learn from that?
Okay, so at first, it wasn't a really big deal, because as a kid, you don't take things, you don't have a big understanding about the condition. So at first it's just maybe fun, because I used to go to Kenyatta and I'd see the wazungus, and they'd really fascinate me. So the monthly visits will really fascinate me as a kid, because it is a school day, and now I'm allowed to be out of school to go to town, the bus, the trips with the bus. So it was kind of fascinating as a child, but growing up and now finally getting to know that I had sickle cell, it got a little bit challenging, because you realize that not everyone understands you as the people you as you grow up. You'll have to meet different people in life, and live with even different people apart from your family members. And sometimes some of them are also family members, but they won't have the same kind of understanding as others. Others might have more understanding compared to other people. So it's different depending on an individual understanding of what sickle cell is. So I faced a little bit of challenges even within the family structure, because I find that some family members do not understand. Sometimes they feel like you are pretending you don't want to go to school when you've had quite a number of crises, painful crises, and you need to rest, or you are in pain and you can't have like a normal day in school, and you need that rest. So sometimes they will not understand. But I wouldn't blame them, because there was not much awareness then, And right now, there's a lot of conversation going on about sickle cell, but still there's more work to be done in the world for even to create inclusive communities within the family structure and even in the community to be able to accommodate persons living with sickle cell. I'd say sometimes also address stigma in school, because most people thought that I remember there's this one incident when I was in primary school when a certain classmate said that I had HIV and AIDS. It was bad because during that time there was a lot of stigma around HIV and AIDS, and being an adult right now, I know more about HIV. I wouldn't myself discriminate against someone living with HIV, but it creates a different kind of stigma on me, because I felt like now my classmates thought that I had HIV, and other people think that HIV is a killer disease. You know, now they think that I'll spread the disease to them and everything. So there's a lot that went into that, and I felt so bad that they didn't know what sickle cell was. And unfortunately, at that time, I couldn't be my own advocate. I wouldn't sit them down and tell them that this is not HIV, but this is sickle cell, and this is what sickle cell is. So.
So how did you back then advocate for your needs, Helen?
Okay. So back then, maybe when I even talk about. Sorry.
Can you turn on your video?
Okay.
Yeah.
So back then.
I want to see the Shujaa.
Okay. Thank you.
Okay.
So back then, because awareness and advocacy comes in different forms and structures and in different setups. It was not only in the school setup and in the home setup, but also in the medical sector. Sometimes the way that I will advocate for myself is just tell the doctor that or the nurse that is attending to me that this and this is the medication that I am supposed to use, or this and this is the injection that I use, and this is the injection that I cannot use for a painful crisis, because every patient is different. From what I've learned living with sickle cell is that every patient is different, and they should be treated as such, and the care should be individualized rather than generalized when it comes to taking care of persons living with sickle cell disease. So for what works for me could not maybe work for another patient living with sickle cell. So what maybe I used to tell the doctor is I cannot use pethidine as a pain reliever to relieve my pain when I'm having a painful crisis, because it's really strong on me. But for the other injections, I can use comfortably. Injections like tramadol, and if tramadol sometimes is not working with my pain, then they could take it a little bit a notch higher with morphine. So I used to advocate for myself in that manner, and maybe tell them that when I'm in pain, then they need to give me normal saline. Because sometimes you go to the hospital and you realize that sometimes you know, sorry to say this, but sometimes you might find yourself knowing more than our clinicians found in the facility. So it is okay for even clinicians to embrace that, not feel like the patient is trying to teach them their work, but embrace that as a daily learning lesson, because we learn every day, and if you're only open to learn, then can we be better service providers in each and every sector that we work in, because every industry, sometimes you might find what you learned in school in theory is very different from what you apply in real life. So the practical part of it is very different from the theoretical part of it, and people should embrace learning, and more so medical providers are taking just their time to go deeper into research and learning more about what sickle cell and hemophilia is, to be able to support persons living with hemophilia and sickle cell disease.
Great. So let's say you're your own Shujaa, and you being an advocate of yourself and being your own doctor, you'll be able to at least tell them when you go to the hospital to at least know more about you when it comes to now drugs, what works and what not works. You're
Absolutely.
You're a Shujaa, and
Yeah.
looking forward to see more of you out here as you advocate, as you use your ways to at least craft change in the community that we need and the care that we need. You mentioned a lot is happening in the world, and through the initiatives that we as patients have at least taken the step to start something, I must say that the Lending Hands initiative is a turning point for the people living with sickle cell and in collaboration with Hemophilia. What inspired you to turn your personal pain into a purpose to start the Lending Hands initiative?
Thank you so much for that beautiful question, Pius. For me, what inspired me was not only my pain, but also the pain that most caregivers taking care of these sickle cell warriors go through. Because I saw firsthand with my mother the way she struggled with me whenever I had crisis. And my mother had 3 children living with sickle cell disease. And just like her, there are other parents out here having more than 3 children living with sickle cell disease, and even 3, 2, and even more people living with children living with sickle cell disease. And it is very tough for them. It is emotionally and mentally draining for parents, and they need that psychosocial support. They need a community around them. So what inspired me was my own journey and the journey of my parents and those people who just came to be my caregiver along the way as I walked through this journey living with sickle cell disease. So I was fortunate enough to volunteer for an organization called Catholic Medical Mission Board here in Kenya, Siaya County, Kenya, and they were implementing HIV programs. And through my volunteer work there, I learned a lot. I was able to see how HIV programs were implemented and how care was given to persons living with HIV, and that sparked something into my mind, because I asked myself, why can't we borrow ideas from the HIV space, HIV, TB, and malaria space, and bring this lesson that we've learned over time into the sickle cell space and be able to create strong advocacy, not only for treatment and care, but also psychosocial support and mental health for caregivers and warriors living with sickle cell disease. Because mental health is a very cross-cutting issues in all aspects of generally the human being. So when you find persons living with sickle cell, they have been subjected to already a hard condition, and some of the caregivers or warriors that have had to interact with, you find that some caregivers are into depression, but they don't know whom to talk to because they've been labeled in society. They've been sidelined because maybe society sees sickle cell as witchcraft, magini,
lack of knowledge.
So you see, like, they are sidelined and they are not seen as members of society. So they also isolate themselves because they don't know whom to go to and where to go to. But when you have these support group structures within the community, then you find that these caregivers and warriors are able to be part of a community of people who understand them better than the people who do not have lived experience of this condition. So that is just basically it.
That's powerful. I feel empowered, and I feel that you became innovative and structured your way so that it can even empower someone out there. I know. And through what we are trying to do, I saw that in September, you did something towards sickle cell, and that's good. Keep up and use your voice. Don't just sit. Advocate and learn to be innovative and actionate whatever that you are thinking of. Founding the Lending Hands initiative, the work that you've done through education, empowerment, and support. What has been the most rewarding part of the Lending Hands initiative?
I think the most rewarding part of Lending Hands initiative has been working this journey with the different caregivers that are within our support group.
Yeah.
And also, just as you mentioned, that this past month, September, we've had a series of activities where we partnered with the county blood bank, satellite blood bank here in Siaya, and we were able to do 3 blood drives in 3 different sub-counties here in Siaya, namely Game Sub-County, where we conducted a blood drive at Sagam Secondary School. And we did not only take the blood drive there, but we also created awareness amongst young people. I believe, Pius, that I believe that awareness and sensitization should be more for young people, especially for those people who do not know about what sickle cell is, those people who are within their reproductive age, so that they can know. Because I feel like sickle cell is also a reproductive issue, only that people do not like see it in that light. But I believe that sickle cell is a reproductive health issue, that everyone should be able to know their genotype before they get into marriage, so that they do not continue the cycle of sickle cell and bringing forth children living with sickle cell. Not because children living with sickle cell are cursed, but because we do not want to continue another generation going through pain and all the challenges that comes with living with sickle cell disease. So we created sensitization amongst young people in their reproductive ages. We targeted high school, secondary schools, and tertiary institutions. Another tertiary institution that we targeted was in Alego sub-county, which was Siaya, the Siaya National Polytechnic, and another one was Sega Polytechnic in Ugenya. So through this awareness initiative, we've been able to reach a number of young people with information on sickle cell and what sickle cell is, and where to conduct the test when they get a partner whom they want to settle down with, and start a family. That it is good to actually know your sickle cell status before you get into a commitment for marriage, and even before you decide to just have a child, because it is financially, it costs us financially to take care of a child living with sickle cell. Mentally, because of the mental stress of constantly having to rush your child to the hospital, sometimes at the wee hours of the night, because crisis can happen at any given time, even at midnight. Sometimes even, especially with the rural communities that we are serving, they do not know, or sometimes it could find you at midnight, and means of transport becomes a problem, because here mostly the means of transport is motorcycle, and to call a rider during the night to take your child to the hospital, sometimes they might ignore your call or refuse to come, maybe due to security issues, or just maybe they've switched off their phone. So it becomes very stressful to even get to a healthcare facility during those times. So this is why we want to create a lot of awareness beyond even the Sickle Cell Awareness Month. We will continue with this awareness creation throughout the period that we will be serving the community. And we are working with caregivers as partners to just spread the word for caregivers who volunteer their service to community, and they really feel like this is a need and this is an issue that we really need to break within the community. So yes.
Basically, we need to integrate whatever that you said on the part of caregivers, their children, and out there. You never know what the caregivers go through when their child has a blood disorder. And it's painful to see that a person lacks knowledge and the person is a patient. It's really not good, but let's all advocate. I'm looking forward to work more with you for that. Reach out to that and diagnose that yet known person that doesn't know more about living fully and living a more happier life. So how do you manage your health as a Shujaa?
For me, I think I came to learn that it is important that I learn my triggers. As a sickle cell warrior, I should learn what triggers my crisis. So once I learn what triggers my crisis, mostly one of the biggest trigger that I have is stress. when I'm stressed, then I mostly fall into an episode of a painful crisis. So I try avoid it. I know as an adult, it will be very cliche to tell someone avoid stress, because you're an adult. Sometimes stress is inevitable, but you just find like ways to manage this stressful situation. You by having maybe close people that you can talk to, just find a way to relieve that stress, so that you don't pile it up and it turns into something that it is not now manageable, or it turns into depression and it gives you like frequent episodes of crisis. I know for us warriors, we have different kind of triggers. Sometimes it might be dehydration, so we hydrate a lot. And also another thing is dieting. I also realize that times when I am not feeding well, I also fall into a crisis. So I try and diet. Another triggers for me is maybe engaging in very vigorous exercises. And as an adult, sometimes people may not understand, or they may think that you have high standards. But for me, I really don't sometimes care what people say, because I know I am managing myself. So if it is to get someone to help me, I'll do that. If I don't have maybe the resources to bring someone to help me at that moment, I'll put that thing at bay, so that it doesn't have to stress me until the day that I'll find someone to help me out with that thing that I need to be helped around with. Like house chores, I don't engage in a lot of house chores. I don't start mopping, doing dishes, and doing everything so that I may look hardworking. I always tell people that I'm not a hardworking person. So I I know myself, so I try find the help that I need to get someone to help me. It is financially draining, because sometimes the economical situation, you find that you don't have maybe money to. Other people may not be privileged to have money to find someone to help them, maybe around with the house chores, where they are living and everything. So it is challenging for people, and even with the tough economic times that we are facing right now, it is hard, because you have to balance between putting food on the table, finding someone to help you so that you don't go into a crisis, and also to just manage yourself well. Eat a very balanced diet. It doesn't have to be an expensive diet. It just have to be balanced. Beans. I love pumpkin leaves. I take pumpkin leaves. I love pumpkin leaves. And I heard that pumpkin leaves help a lot in the boosting of blood. And also another thing that I love, I don't know the name in English, but in our local language, we call it terere. Yeah.
I know it.
So I eat,
some...
yeah. Yes. So I eat terere, especially in times, and as a woman also, it becomes difficult if you've not mastered your body and yourself, because women go through monthly menstrual cycles, and persons living with sickle cell are naturally anemic, and sometimes when they're going through this menstruation period, you tend to find that someone goes into a painful crisis, because maybe. So what I do for myself, it used to happen to me before, that when I'm about, or when I'm going through my menstrual periods, then I'd have a lot of painful crisis episodes every month. I'd experience a painful crisis episode every single month when I'm going through my monthly menstruation period.
It says that you have to plan yourself and know the diet that you are taking.
Yeah, so I'd eat well. Before that week that I am going, and I ensure that I'm eating a lot of vegetables, especially that terere vegetable and the pumpkin leaves and the ugali. So I eat strong food, and food rich also in iron, but not supplements rich in iron, because we are not supposed to take a lot of supplements that are rich in iron, only folic acid. But other drugs that are very heavy with iron, we are not supposed to take, because it causes iron overload and causes the enlargement of the spleen. So it is also good, even as a patient, to do your own research on what works for you, for your body, and what you should not be doing and what you should be doing. Yes. And also what matches your pocket, just as you said. Yes.
All right, Shujaa. You are literally an example of what needs to be done in the community, and you being your authentic you, it will attract, it will at least solve a person that maybe saying that you are here, but you know where you are, and don't avoid stress. I think learn to cope with it, and you will live a more fulfilling life through planning your life, through knowing the things that you can accomplish, and don't just stress, because we'll still die. So when you stress right now, it will be hard for you to manage.
It's inevitable for everyone, even those not living with sickle cell. Everyone will die. So if I encourage patients living with sickle cell to take life positively, and just because it all starts sometimes it all starts in the mind. If you believe that you can live to see the goodness of the Lord in the land of the living, just as the word of God says to us, then you will live to see the goodness of the Lord in the land of the living, and you will fulfill your purpose here on earth, because each and every person placed on the surface of the earth came here for a purpose. We didn't just come to occupy. We came to occupy and own territories, as just as the Lord promised, that as far as our eyes can see. So we are here for a certain reason. Maybe just you as pews, as you are here to maybe create advocacy and maybe awareness around hemophilia and sickle cell through your platform. This is a calling of that God has created in you to help maybe impact lives. So everyone has something in them to create a difference in the world, and just share out their kindness and share a portion of themselves and their lives with someone else. So I actually believe that we do not come on earth to just live and go, but we come so that we may live for each other. Like I might have something that could solve someone else's problem. So that is my God-given gift, and everyone has it.
And create change together through connecting and building a world that will motivate us all to have a purposeful life. You touched on peer and awareness. What message do you have for young people living with sickle cell who feel limited by their condition?
What I'd love to tell persons living with sickle cell, I know persons living with sickle cell come from different and diverse type of background, and giving a one inclusive advice might sometimes not be very practicable. But what I'd love to say to them is, just as I've said, everyone here on earth has a purpose within them. And God says in his word that when he created us, he knew us even before we were implanted in our mother's womb, meaning that he had a plan for us even before we were implanted in our mother's womb, and he knew us by name. So the fact that God knows you by name, you should hold on and hang into that. You must always believe that there is a higher power than you. We must always believe in something that is more powerful than us, so that even if you're not a Christian, maybe you're a Muslim, but you must always have something that you believe and pray to. Okay? And so first is God. For me, it's God because I'm a Christian. And also always just pray to God. For me, faith and prayers has been the anchor in which I've held on to throughout the years. I think living with sickle cell also makes you mature at a very tender age, because you get to experience people cannot fake kindness for so long, so you get to experience people sometimes in their rawest of form. So I I think like you get to mature very early as a child, because you get people who treat you differently, and you kind of learn from those different experiences. So I'd love just to tell them that they should hang on to faith, that there's something bigger within them, and that they should not stigmatize themselves. That just because someone thinks that you are not good enough doesn't mean that you are not good enough. So they should just hang on to faith, believe in God, take their medication, most importantly, and just take a good diet. It doesn't have to be meat and fish and these diets that people consider that are expensive. But you can cook something. I've come to discover that sometimes palatability of the food, the taste of the food sometimes determines how we perceive food, and how food is prepared determines. This is one conversation that I have a lot with the caregivers within our support group, that if you find your child does not like a certain type of food, try and make it in a different kind of way, so that it may be interesting to this child, because mostly you find that persons living with sickle cell do not suffer from maybe sometimes lack of appetite, especially children. I suffered from it myself. I was a very poor eater when I was a child. But nowadays I try. But also, as I said, every individual is different. Some may suffer from lack of appetite, others may not. And some may be slender or slim physically, like I am. Others may be a normal sized body or fat, or so it depends. Every person is an individual, and bodies should not stigmatize themselves first. Let other people stigmatize you, but never talk negatively about yourself. Don't ever have the thought of having that negative self-talk within you, because if you speak it over your life, then it blossoms, it grows, it becomes a tree, and it eats you up. So I'd tell them to love themselves, love themselves more than anyone else love them, because the world needs us to be a little bit selfish. So because so love themselves, take care of themselves through dieting, hydrate, take medication, avoid everything that can cause you stress. Just avoid it. Anything, and I mean absolutely anything. Family, because sometimes I feel like some caregivers or some warriors face a lot of stigma within the families, and most of the families that we've dealt with, even with the caregivers, mostly they say that most stigma comes within the family, either from the extended family or the family in which they are married to. So it's something that we will be able to tackle communally as we bring together our voices and strengthen the patient advocacy, because I feel like communities are expert in the things that affect them, and they should be carried as such. So when maybe the UN and when we're having those UN high-level meetings concerning NCDs and mental health, and we should never leave out patient advocates, because communities are experts, and even caregivers, because they know they have the first-hand information of the very things that affect them and their families and the community, and how the community perceives conditions and rare diseases like sickle cell disease and hemophilia.
All right, let's work together, and I'm looking forward to craft change with you. And I take this opportunity to thank you for the opportunity, and thank you for the story that you've shared, and it will always impact change out there as long as you give your all to create change. Thank you again, and God bless you. Looking forward.